So children that attend daycare can get up to 8 to 10 upper respiratory tract infections a year. These are usually common colds caused by viruses. Each episode usually presents with fever, which lasts for about 3 days, and is accompanied by upper airway secretions, snottiness, and a wet, productive cough, which can, in the most serious cases, last up to 3 weeks. The so-called Créche Syndrome is this child who presents with excessive upper airway secretions together with a wet, productive cough in a child that's going to creche. Because the child gets so many infections a year, it seems that the child does not get better, but when in fact is just running in from one infection into the next. One should see the paediatrician if the fever presents for more than 3 days. If the child is persistently vomiting or not feeding well, if the fever is associated with any sort of pain, headache, earache, abdominal pain, bone pain, joint pain, or if the fever is accompanied with a rash. If the child has any breathing abnormalities, medical intervention is needed urgently, such as labored breathing or noisy breathing. The child needs to see a doctor immediately. One should look at the general hygiene policy that the creche has, and this is encompassing the hand hygiene that the staff use when interacting between the children and also teaching the children hand hygiene themselves. One should also look at the sleep hygiene that is practiced in the creche. Are the children sleeping close together or are they widely spaced apart? One should look at the meal time and the formula preparation hygiene, and are the meals and the bottles prepared in a hygienic fashion. One should look at the structure and the ventilation of a creche and make sure that the creche is adequately ventilated with wide open windows and doors, allowing the child to run around and play freely rather than be cramped in a cramped, crowded space. A parent should always review the sick child policy that a creche has, and that this should be a written policy that is adhered to by all the parents and enforced by the daycare staff, that acute medication should be administered at home, and that a child with fever should remain at home until better. A creche should have a strict immunization policy, that all the children admitted to the creche should have their immunizations up to date to prevent widespread spread of diseases such as measles, mumps, rubella, chickenpox. It is important to also make sure that your creche is registered with the Department of Social Welfare and that the teachers are adequately trained in childcare.